Personnel Committee to order. First item of business is the approved minutes of last month's meeting. Motion by Supervisor Simpson, second by Supervisor Merlino. All those in favor? Aye. Dr. Duffy, would you like to give a short presentation? Thank you.
Boy, you are right on schedule today.
Time is money.
Well, good morning, everyone. Thank you. Okay.
You have the floor.
Thank you very much. So I just left. We just welcomed our last group of accepted students today, another 100 or so. So we'll be ready to kick off classes next Wednesday. Just wanted to share and remind everyone we do have our joint county meeting coming up on September 13th at 10 o'clock on campus. And that's the time where we have both county committees come together to share our capital request for the year. This is our annual process. In order to get any sort of state match for any funding we have to first present to our board, which we're doing tonight, and then present to you all, asking for your approval, and then that's sent out to the state, and then that becomes part of the state budget process. We are not asking you for any contribution to capital at this point. The projects are primarily funded by our capital chargebacks that we get from outside of Warren and Washington County, as well as some private funding and donor donations to our foundation and our establishment. So no list from you, but you are required to review those and approve those hopefully going forward. So that will be coming up on the 13th. As I said, we will be kicking off our semester next Wednesday. Enrollment for fall, we're right on target for meeting our budgeted enrollment goals. Although we've had a decline over last year, we have projected for that, and we will be in line to meet our budget, which is the most important thing. Of course, we want to make sure we're continuing to serve the county's needs and other students, and so we're always looking for new ways to attract new students. But we're feeling pretty good about, especially our new student enrollment is actually stable, which is where we want it to be, considering the demographics and full employment, which has a tremendous impact on us. When there are jobs, people don't typically go back to school. So although it's good for the economy, for community college enrollment, we have that inverse relationship, and so we're working through that. Housing, we're at full capacity, and we expect to be so that's always a good sign too. There still are students attracted to coming from outside of the region. We end up also participating in activities here. We have our new students, about 250 will be moving in tomorrow. So we have a whole weekend of activities slated for them, including taking a boat ride on Lake George, integrating them much more into the region than we have in the past. We actually had a donor that contributed to allow us to make our orientation program even more exciting for students. And also, one of the feedback we get from resident students is, you say you have this great area, but we never actually get to see it that much because they may not have transportation or the wherewithal to be able to travel around the region. So we've incorporated it into their new student orientation weekend. We're taking them on a hike and really introducing them to the Adirondack. So we're excited about that. And then finally, from an enrollment perspective, the programs that we've seen the most growth in this fall, our agricultural business program, which we launched a year ago. We saw double the enrollment than the year before, which is a good sign. Mechatronics, also a new program. We're also getting some good traction in terms of enrollment. That's a program that was really designed in concert with our local manufacturers, so it's kind of a combination of electrical, mechanical, and robotics to be really more in line with what our manufacturers are needing. Culinary arts, as you can imagine, and we would have hoped that having a brand new location and in the facility, and we have seen an increase in students enrolling in culinary arts and baking arts. And then physical education. We started that program a year ago. It's taken off quite a bit, so our attention to our gym and our facilities is going to be even more important going forward. But we went from 0 to like 70 students in a matter of 2 years, so there's definitely an interest in that area, so we're excited about that. And that's all I had to report to you today, and I'm happy to answer any questions.
Any questions for Dr. Duffy?
In a minute.
You go ahead.
Sure. The orientation sounds fantastic. I really keyed in on the idea that this is a great area, and you're going to introduce them. When you said hike, it made me think, welcome to Warren, Washington County area. We need to do a tech check when we get back.
I will bring that back now. Good reminder.
When's the restaurant open?
They will open the second week of September. They have to get the students up and running and ready to run the restaurant, so those will be Wednesday and Thursday nights. And then there also are some special programs. We're doing what we call collaborative cuisine. And unique this year, we're actually partnering with, through the Lake George Chamber, the Taste of New York products. So they'll be partnering with all the products that are made here in New York and a lot of them in this region and incorporating that in the menu. So I think there's 3 of those that fall on Friday night.
Any other questions? Thank you for coming. Appreciate it. Okay, next item of business, Human Resources. You have the report of vacancies. If you can read it, you can ask questions. If you can't read it, we'll just move on. It's very small. Any questions on the vacancies? Okay. Our next presenter will be Matt Schuett from Yeager and Flynn, and I want to caveat, I have given him 10 minutes, but he may overshoot his time limit, but we have a lot to cover on the health insurance, a lot of important information there. And I could say going into next year, we look in pretty good shape.
Goes my health.
So take as long as you want, Matt.
Sign with.
Within
Right.
10 minutes, huh?
You're good.
You
Thought I had more than 10.
Oh, okay. Well,
No questions, I guess.
thank you.
Okay, so there's some materials going around. Morning, first of all. And I'm really going to follow along with that today. You'll note, first thing you probably note on there is that Kurt's not with us today. He sends us regrets. He can't make it. And the other thing is that's probably how I looked about 10 or 12 years ago on that. That is an older photo, so we just keep using it and rolling it forward. So on the, if everybody has it, a couple things. So we met with the working group on Tuesday, and the purpose of that really is just for us to go over, where the direction of claims is headed, what the open enrollment's starting to look like, planning for that, and going over all aspects of trends. And just as a quick reminder, the working group's comprised of HR Director Jackie Figueroa, the Treasurer Mike Swan, Administrator Ryan Moore, and then Supervisors Conover, Garrity, Simpson, Sokol, and Thomas, and that's all alphabetical, so don't get bent out of shape if I didn't put you in the right spot. So a couple things as a reminder. Your health plan is self-insured, of course, and you've heard me say that over and over for the past few years, and it serves as kind of a reminder of what makes up your health plan. So your health plan is made up of, obviously, your claims. So when I say a claim, that's people using your health insurance at doctors or getting a pharmacy or hospitalization. It's made up of that, administrative charges, and reinsurance. And of all that bundled together, your claims, actual use that the employees use, your members use, and you have 1,600 members-ish, and a member is any employee or a spouse or a dependent child. All those claims rolled up make up nearly 90% of your costs, with administration typically being, like I said, around that 10% or so. So, you're like, Warren County is not unlike most employers in the area, where you have the lion's share of your employees have low to average utilization of health claims. And you have some, just like every other group, that has some high-cost claimants. Okay, that's out there. That's the nature of what makes up healthcare costs today. And some of the high-cost claimants of any group start to become very, very high and influence your renewal. With that, you're probably, most of you already jumped ahead, but I'm happy to report on page 2, our increases, the changes this year, and with everything that's going on in the healthcare environment, are very, very reasonable, very minimal, and well below average. We're looking at, for your lead plan, which is your EPO plan, it's a 2% change, and your high deductible plan, it's a 1% change. Now, those of you who insure your own towns, the average, what the state just approved, just to give you a comparative, the Department of Financial Services just approved for 2020 about a small group rate increase of about 7.9%. That's average across the board. Yours could be higher or lower, but that's an average statewide, and the state has influence on how making those rates up. And in addition, it was just looking at some benchmarking and trending. The average increases that are predicted 2020 for large employers nationwide is in the 6% range. So when I say no increase is good, I recognize that. But to just put it in perspective, this year's change is below what the market is typically. Okay. A couple things. I want to tell you what goes into our rate development. We're looking back, so these rates that are on this page, you see your current and your renewal rates. That's projecting. We have to project and have an idea where claims, where utilization, and that's for medical and pharmacy and on, where all that's going to end up, even all the way out through the next 15 months. We have to project that try to project that all the way through the end of 2020 when projecting your rates. So when doing that, we're looking back at how your historical trends have been, considering, a lot of different things that go into making up, increases and taxes and whatnot that make up your rates going forward, and where people will be using your health care. I will say this, you mentioned it last meeting, we avoided, keep in mind, being self-insured, you avoided about 2.5% of tax that was coming, hitting all health plans other than self-insured plans. Okay, that was a tax that's unavoidable for most. You don't have to, it's not applicable to your plan, so we avoided that. And as I mentioned earlier, some of your high-cost claimants and just the general direction of claims, if you were still fully insured where you were a few years ago, I think we would probably be fighting for our lives to keep the increase under 15% or so. So being self-insured, being able to have that flexibility, being able to budget and predict and have some influence over the plan over time is where we can keep the increases at a reasonable level. So I want to pause there before I go too much further and for any questions. I realize I'm cruising through it a little. Nothing. Okay.
You're doing a good job, see?
Good job.
Thank you. So a couple other things as we're going through this. Incidentally, I should have probably said from the beginning, this is clearly you're under union contract and your benefits are negotiated, but it's important to say too, there's no takeaway on your benefit plan. Okay, so there's no watering down that happens. This is a pure change of 1 to 2% on your plans without influencing your plan for the negative. But you'll see on the halfway down or so on page 2, there are some plan enhancements. There's some improvements that are being made, which I think are significant. You heard me last time talking about telemedicine. Has anybody had I don't want to put anybody on the spot. Anybody used it in this room? Two, all right.
I haven't used it.
You're pointing
Can
at
I just
Jackie.
make
Sure.
it would be nice to understand how to use it easier, because I do have small children, so to be able to just call up and be like, hey, my kid bonked his head or split his finger open, does this need stitches? To be able to call first would be really nice, but I don't really know how to use it yet.
We have instructions in the office. It's an app,
I'm sure if you call the office, somebody could walk you through.
Call the office, absolutely. In addition, we're going to message about it more in the open enrollment meetings, and there's going to be a video link inside of Employee Navigator. That is the hardest part, is just starting it, getting it started. So, but there's going to be, I think we'll have more interest in it this year and going forward, and because what's going to happen today, right now, it would cost your employees $25 for an office visit, seeing a doctor, eye to eye, or $25 through telemedicine. So you're not today, right now, you're not saving money per se, but you are saving time, a good amount of time. As of 12/1, the enhancement to the plan, it's going to be going down. The telemedicine, your regular doctor visit will be the same when you go to see somebody face to face. It's still $25. But if you use telemedicine, as of December 1st, it's going to go down to $10. So there's a financial incentive as well. Ease of use, I've used it. Telemedicine is not a newer, it's not new. We've had it for a few years. It's just getting it adopted, getting people to use it is the next step. But it is pretty easy. You take we say call, but I don't have my phone here to use it just as a prop. But it's you log on to the Blue Shield website, and you put in your information, you actually have a credit card on file, because that's how you pay. You're paying for a provider's visit too, in this case $10, and then you're kind of quote-unquote in the waiting room. You're waiting to see a provider, and then a few minutes later a provider props up and you're engaging with the provider. And I'm talking about things of, and these are providers, actual doctors that are part of your network, so it counts towards your out-of-pocket maximums. If you have your deductible, these charges count toward that deductible plan. And they diagnose you, and they can have a prescription ready for you at your pharmacy when you go get it. It's so ear infections, sinus infections, basic stuff is where you generally go for those types of things. But I think that's a nice enhancement. That's a nice enhancement. It's going to save everybody money and time now.
I have questions. Jackie?
Well, just a comment, because I wasn't aware until I used it. There's also mental health providers, and you can schedule appointments, but one of the little videos that we sent out made this comment or the point that in an area, maybe a smaller town, where you might not want to go and sit in the waiting room and see everybody that's at like the psychologist's office, you can do that through this as well as scheduled appointments. So it's I thought an interesting aspect to it, but I did it for a sinus infection. You take your temperature, answer a couple questions, and the doctor pops right up. Stick your camera down your throat, show them everything.
Yes.
You don't have to do that, by
Supervisor
the way.
Sokol.
And it's also important to note, too, that if this telemed provider can't help you and you have to go to the emergency room, you don't get charged the amount for that telemed call. They credit you, Matt, or they just don't?
Yeah, if they can't help you, they're not. The intent is not to double hit you, right? So yeah, if they find something and that is appropriate, right? There's situations you want them to say at times, hey, we can't help you here. You need to go to your regular provider. Well, they don't want to charge you for that type of service. You don't want to pay 10, then 25. You don't want to get hit twice.
Supervisor Rady.
I don't use download apps. I forgot my EOP number, whatever. So since I don't, I'm just thinking, because I'm an old guy, having an 800 number, but having our medical card to give them, verification of who we are, wouldn't that be the most simple path going forward?
You mean saying outside of video?
Well,
The program it does have to have, whether it's, and many people do it on their laptop or desktop. You don't have to download an app. You can just website.
laptop.
Mhm. But you have to have a camera-enabled device, something where and you flip to what Jackie had said. You kind of turn the camera around, and they use that as a way to, my son's example, he had strep, and they actually look and they can see the white bumps, and that's how they say, yep, that looks just like what strep is, and how long have you had a fever, blah blah blah. So, but it has to be camera-enabled.
Very good.
Okay. So good news. The other two enhancements is we're taking advantage and adopting a mandate in 2020. New York State has, for all fully insured plans, it's required what we're just calling a fertility mandate. Covers a couple layers of infertility, artificial insemination, in vitro fertilization, preservation. The county is adopting that, and the various mandates that are put on that. As a self-insured plan, you're not required to do that. Now, you are offset. I think companies are doing it, although not required, as for those that need it, it's a very, very good benefit. I'm sure some of you know some people who have gone through that and the expense that's related to it. It's a very good benefit to have. It does help with the people who have the need. It also helps with attracting new employees and retaining existing employees. That mandate has some cost associated with it, naturally, but it's offset with the one on the bottom, which is, it's called the Save On program. Some of you may be aware of this. There are prescriptions, but typically your high-cost prescriptions that are out there in the world, specialty prescriptions that have high costs associated with them. They also sometimes have coupons, manufacturers' coupons associated with them to offset that cost. Going forward, as of 12/1, we're going going to be able to use, as a company, the coupon to help employees and the county. So right now, if an employee has a specialty prescription, it's costing them $50. The coupon, we're going to be able to seamlessly in the background use that coupon to make their cost for that prescription, if it's eligible, zero. No cost. We're going to take some people and bring them from $50 to zero. If that coupon has any value remaining, that's going to help Warren County also. That coupon is going to be used to offset some of Warren County's costs. So a win-win on both sides. We're looking at all these three enhancements as no takeaways, all good things, and enhancing your benefit package overall to your employees. Went over a lot again. I'll pause there before we get to some of the other stuff.
Yes, Claudia?
Looking at the package as a whole, I think that's great that we're able to offer these additional services while still holding costs fairly low, and finding these other mechanisms to reduce our employees' costs. So I think the fertility and the artificial insemination and in vitro, all of that stuff, even though it's not technically mandated for us, I think it's a good benefit that we can offer to people, and hopefully be an HR attraction for new hires.
Agreed. Thank you. Okay. A couple other items that we have that I need to go over with you, and then some housekeeping on previous meeting items. So on page 3, you have other lines of coverage which don't get nearly as much attention as your health plan, but also affect employees to some degree and need to be looked at. On the top of page 3, your Medicare Advantage plan, your Medicare eligible retirees. You may remember last year we spent some time educating and talking about the move we made from CDPHP and Empire Blue Cross to Humana. If you recall, Humana really had a very, very attractive price on the table last year, completely changed the game as far as the rates are concerned. We had a second-year rate guarantee because, recalling we were concerned, me included a little bit, that the rate was so low that it was going to blow up year 2. Remember some of that discussion? So we had a second-year rate cap on it. Well, the rate came in at 8.16. They could have come in at 12%. Many times we see companies do that. They go right up to the max in year 2. I think it was very fair at 8, call it 8%, an 8% change. You see that number, it's 207.53. Just for reference, last year's rate when we left them, you had 2 plans. One was $300 a month, one was $417. Okay, so, and that's last year's rate. Those would have certainly inflated. So we're still, wouldn't do anything with that plan. I would keep it as is. It's working wonderfully. It's been below average. And of that 8%, 6% of it is made up of federal tax, believe it or not, a new tax that got reinstated. It's called the health insurance tax that, as your active plan, your Blue Shield plan is not subject to it, but Humana is.
Sorry. Bugging my
I'll
colleagues
stay out
about
of
the
that
federal
one.
tax because...
You can't make this stuff up.
Right. So, yeah, just to pour a little more salt in that one, so you'd be around a 2% increase without the tax, just for fun. So, but that one I wouldn't change at all. Incidentally, so you all know, in this room there was nearly 500 retirees that we moved over. Out of 500, we've heard a handful of complaints, most that were resolved. The massive lion's share of employees haven't heard a peep. They've been very pleased with it. Again, out of 500, there's going to be 1 or 2, just little stuff, but nothing major. I think it's gone very well. It's been the take that we've had from it. The other ones are fairly simple. Dental, we're recommending staying the same, renewing as is with Delta Dental. There's no change to the county's budget, no change to the employee, it's just as is renewal. And we give you the enrollment of how many. There are a significant amount of employees in that plan. No change to them, no change to you. The vision we've had in place, and I want to put this in perspective, there's a 2% rate change. This is the first change that we've had, and this will be the 3rd year of it. And I want to put in perspective, 2% is 12 cents for a single person per month. Okay, so very reasonable. It's going to come out to be somewhere in the neighborhood of 4 cents per week or so. So for a single employee, and 30-ish cents or so for a family. So very, very reasonable. But I'll certainly pause for questions on either of those, any of those that I just covered. Okay. Lastly, this is a refresh from where we were last time. We just now need to take some form of action to get it into, to progress and get it into the open enrollment. Last time I had talked about new offering, employee paid, no impact to the county financially, adding to your electronic enrollment system, which is important. Again, just no paper. We're not going to need to chase people all over the county for paper and signatures and print all kinds of brochures and kill trees and all that. It's all going to be done inside of the electronic enrollment system. And the life insurance, as a reminder, the benefit of it is the employees can choose it if they want, or they can decline it if they want. No pressure. It's up to them, up or down. They choose it yes or no. The benefit of doing it through a group versus individually, as a reminder, is that there's no health questions. An employee can get up to $200,000 of life insurance. It's term coverage. It's not whole life. It doesn't have borrowing capabilities and cash value and all that. It's basic insurance. And you can get up to $200,000 with no questions asked. There's not a smoker, non-smoker question on it. There's not a question about prescriptions or your family history or anything. It's if you're actively employed and eligible for the benefit, you're in. Okay. You can insure your spouse for $50,000 up to 50, and I said up to 200, and $10,000 for your child. We also have, again, same stuff that I had covered the last time I was here. We also have voluntary accident coverage. In these programs enhance your menu, again, attraction and retention at no cost to you. But again, I'll pause for questions there because I know we haven't touched on them for a while.
Thanks, Mr. Chairman. Just going back to page 3, the dollar amounts, is that per month or per year?
Which ones? Well, actually, they're all monthly. They're all
All
monthly.
monthly.
Yep.
Family for dental, $76 a month.
Mm-hmm.
Thank you.
Yeah, just for reference, it's not unusual, and some of you, if you look back into costs of the dental plans you have as a family, many of them are well over $100 per month. So it's very competitive.
Yes.
Supervisor,
Yes. So, but on page 2, the dollar amounts are per year.
no.
No.
No, that's
No.
per month. That's fine.
Well, family, $1,600 a month.
Yes.
That's the
Oh, yeah.
county, that's the county's cost.
So let me,
Or-
2 questions. Is the dollar amount annual or monthly, or how is that split? These are monthly costs, monthly premium equivalents, before we cut it up. Okay, because then you have your shares from there. The county pays 75 and employee pays 25 and various splits from there. So yes, if you haven't looked at it in a while, this is what healthcare costs.
So the page 3 is the same thing as before it's cut.
Correct.
County.
Before split.
Okay, all right, very good.
Yes.
My misunderstanding. Thank you.
No
But
problem.
wait, on that, the dental and the vision, though, they pay all of it.
It's a little bit of a mix. On the vision, you're right, 100% employee paid. On the dental, the county does have a small contribution. I shouldn't say small. They pay $10 for a single and $24 toward a family. When I say there's no impact, that number is not expected to change. That number will stay the same.
Supervisor Beatty?
Yeah, I have a question on the life insurance.
Yes.
So is it a 5-year term? Or is it-
So,
It's a group health plan, so what's the term? I know the term is
yes,
what's the life?
they're 5-year rate bands. Okay, so correct. Every 5 years, your rate will bump from that. So it's not like buying. I guess maybe a good way for me to explain it too is term insurance. If you've bought it individually on your own, you can buy 10-year term or 20-year term or even 30-year term where the rate locks in for 20. For that period of time. That's on an individual basis, and it's definitely likely, or it will happen. And I want to just compare quickly so you understand. The anybody here or your employees will have the choice. This is why it's voluntary. If somebody's in very good health and, again, non-smoking, no prescriptions, and they apply for individual life insurance on their own, they can get a rate that's better than this. Okay? We're doing this on a group basis, and it's take all. Okay, no questions, and that costs a little bit more, to do so. And with that, you're in 5-year rate bands, and this doesn't fix. It's not considered. Term insurance gets you through the points of your life where you have typically supposed to have your more debt, more risk, newer families, things of that nature, mortgage. It gets you through your working years. It's not something you're going to maintain well into your retirement. Okay, it's while you're at the county primarily.
So what if the employee leaves employment of Warren County? How is that?
So they can take it with them. Okay, it is portable, and then if they want, they could convert it over time to some form of a whole life or universal life policy.
So it's a 5-year lock-in.
Mm-hmm.
Portable if the employee leaves Warren County. All right. And then it is 5-year, what are we, 2024, and we can negotiate another 7.
Well, it renews to the employee. We don't expect the actual base rates to change. Every 5 years, the employee's rate is stepped automatically. We know what that's going to be over time. If we see any changes, this is just like anything else. This was the winner of 20 or so companies that we work with, and all the various options that we looked at. So there's others if this ends up becoming something that, for whatever reason, the rates change down the road.
Yeah, I didn't see the rate chart. Is the rate chart included?
Yep, on page 5.
All right.
Sure.
Any other questions for Matt on health insurance, on anything?
Okay. Thank you. So, as far as legislative process from here, because it's next steps, as I'm opening that one up, not knowing.
We need to approve the renewal at the premium equivalents laid out in the proposal.
Supervisor Bramer?
I'll make the motion to renew under the recommended package.
Okay, we have a motion by Supervisor Bramer. Do we have a second by Supervisor Merlino? Any discussion? All those in favor?
Aye.
Thank you, Matt.
We need to do the on dental, vision, voluntaries, or
Everything.
The whole package
All
is set?
covered.
Yep.
Okay. Thanks all.
Very good.
Thank you.
Thank you. Okay. Back to the agenda. We have some food service. We have one for Countryside, increase the hours of temporary food service helper to 40 hours per week, and B, in Office of the Aging, we have a position to fill the position of Aging Services Assistant, temporary grade 4. Somebody want to make a motion on both of those? Motion by Supervisor Bramer, second by Supervisor Simpson. Any questions? All those in favor?
Aye.
Opposed, carried. Public Works, naturalist position 2 at Up Yonder. Motion by Supervisor Simpson, and second by Supervisor Leggett. Any questions on the naturalist? All those in favor?
Aye.
Opposed, carried. Okay, tourism assistant. Position of communication assistant tourism, that was discussed yesterday. And delete the position of senior tourism specialist. Any questions? Somebody want to bring that forward? Supervisor Merlino, second by Supervisor Bramer. Any questions about tourism? All those in favor?
Aye.
Opposed, carried. We have no pending items. Higher education, we heard the report. Next, you have a listing of all the vacancies approved by the Oversight Committees. Cleaner, number 12, in Buildings and Grounds. Senior Aide 2, Countryside. Senior Legal Recording Clerk at County Clerk. Legal Recording Clerk in County Clerk. Public Health Registered Nurse. Parks and Rec, Naturalist 3. Public Works, MEO Light 28, MEO medium number 7, senior engineering tech, self-insurance specialists, communications officers and insurers. 212, a sergeant's position, a patrol officer's position, and social services, we have social services welfare examiner number 40, and social welfare examiner number 38. Any question on any of the positions that were filled?
We're about to finish.
We need a motion.
I think.
Yeah, motion approved by Supervisor Sokol, second by Supervisor Bramer. Any other discussions? All those in favor?
Aye.
Opposed, carried. Anything else to come in front of the Personnel Committee?
Motion to adjourn?
Motion to adjourn. Supervisor Bramer, second by Supervisor Lowe.
You now.
Thank you.
Just be really fast.
All right. So, technically, my meeting went for 11 minutes.
Yeah.
Technically,